coming to the pathogenesis. In presence of the underlying cardiac valvular defects such as in rheumatic heart disease, aortic stenosis or congenital heart diseases, there occurs the turbulence of the blood flow. This leads to the damage of the endothelium. And it leads to the fibrin deposition and thrombus formation, and this phenomenon is called as non-bacterial thrombotic endocarditis. Now through the damaged endothelium, the bacteria can easily enter and it leads to the inflammatory reaction and which causes increase in cytokines and platelet aggregation. This platelet aggregation causes the fibrin deposition and increase in circulating von Willebrand factor. This fibrin deposition and von Willebrand factor together cause the adherence of the bacteria to the endothelium. And finally, the prototypical lesion called as vegetation is formed, composed of platelets, fibrin, microorganisms and some inflammatory cells. From this diagram we can see the vegetation has been formed on the ventricular aspect of the tricuspid pulse and on the chordae tendineae due to the high velocity of blood change, and also on the atrial surface of the mitral valve and the wall of atrium because of the impact of blood flow due to comparatively lower pressure. Now coming to morphology, here there is larger vegetations present on the mitral valve, and this is a specimen of non-bacterial thrombotic endocarditis with a series of thrombi formed along the surface of the mitral valve. This is a specimen of aortic valve endocarditis with fluid vegetations as seen on the arrow and also on the chordae tendineae. Now coming to the histopathology. This shows the vegetation formation and with here the organized basal organization. This shows the accumulation of the microorganisms, and diagram sheet shows the neutrophilic infiltration which occurs on acute endocarditis, and it shows the presence of multinucleated giant cells, monocytes and other chronic inflammatory cells infiltration which occurs on subacute endocarditis. This is the histopathology diagram of Lippmann-Sachs endocarditis in SLE, and this is the central verrucous lesion. On magnification of it, there is presence of only inflammatory cells without any microorganisms.